Alright guys, if you're guessing why I'm going live with my top off, I'm not showing off, it's the actual port that's been infected around the skin area, or should I say around the womb area. When it rubs on a t-shirt it hurts. But we're not here to talk about the port today. I received my information pack regarding the brensoactib. I can't say it, brensoactib. Say it again. Brensoactib. Can someone say it for me?
Brensoactib?
Brensoactib. 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 The brain should function. Right, anyway, I received the paperwork today. It's quite interesting because there's 3 different phases here, I believe. One is a placebo effect. So you take a tablet and you think it's the actual tablet, but it's just a placebo for the brain to think that this tablet is actually the brensoactib, and really it's just a placebo effect. But with the study, the person that's giving it you doesn't know which tablet you're taking. Are you taking the real one or the placebo one? And they only find out at the end of the study. So that's quite interesting. So, without any further ado, I'll read you some of this stuff. I'm not going to show you too much, but you can see I've got the invitation there, right there in front of there, the paperwork. And I'll read from here the best I can. You know, I can't pronounce afterwards. You are invited to participate in an experiment clinical research study because you have been diagnosed with non-cystic fibrosis bronchitis and have a clinical history of consistent with the NCFBE. Joining the study is entirely up to you. Before you decide, we would like you to understand why the research is being done and what it would involve for you. This informed consent form describes the study to help you decide whether you want to participate in this study. It explains the purpose of the study and its details. This form describes the procedure you will require to complete if you choose to participate in the study. It also describes potential risks and benefits of the study. This form uses words such as treatment, drug, medication, and participants. Please remember this is an experimental study. The use of these words do not mean the drug has been shown to be safe or will improve your condition. Some risks of this study are already known. The risks are listed in this form to help you decide whether you want to participate or not. Not all potential risks are known, so consider all details carefully. Page number 2. What is the purpose of this study? The purpose of the study is to evaluate the efficiency, safety, the tolerability of brensoactib and the treatment for NCFBE. This is an experiment clinical research study of a study drug called brensoactib. Experimental means the study drug is currently being tested in clinical research and studies and has not been approved for use in treatment of patients with NCFBE. In addition, experimental means that we may not have all the information about brensoactib. Before new drugs can be approved and sold to treat specific diseases, they must have to be tested in an experiment clinical research studies. The results such studies are then provided to the regulator authorities. Brensoactib is not approved to treat NCFBE by the United States Food Drug Administration, the FDA, or United Kingdom Medicines and Healthcare Products Regulator Agency, MHRA, but it is undergoing clinical investigation to determine if brensoactib is safe and effective. Do I have to take part? No, it's up to you to decide. Yeah, sorry, I was just making sure my address wasn't there. No, it's up to you to decide. Your participation in this study is voluntary, and you may refuse to participate or withdraw from the trial at any time without penalty or loss of benefits to which you are otherwise entitled. The study will The study staff will explain any words, procedures, and risks to you. You will be provided with a copy of this form to take home and read again. You may want to talk about the study with family, friends, or your regular doctor before making a decision. If you do decide to participate in the study, you will be given this participation information sheet, an informed consent form to sign and date, and you will be given a signed and dated copy to keep. This study is being conducted by INSMID Incorporated. INSMID is the sponsor and is responsible for the overall cost of this study. The study doctor is being paid by INSMID to conduct the study and studies related procedure. Study design. Approximately 1,620 participants between the age of 18 and 85 with diagnosed NCFBE are expected to participate in this study. The study is being conducted approximately 480 centres in North America, Europe, Japan, and the rest of the world. If you are eligible and you choose to participate in this study, you will be randomly assigned by chance, like flipping a coin, to one of the three study drug groups: brensoactib 10 mg tablet once per day, brensoactib 25 mg tablet once per day, or the placebo, a sugar pill which contains no medicine but is the same form as the study drug brensoactib. The placebo looks just like brensoactib but has no active medication in it. We do not know which study the medication is best for your condition. To try and make sure the treatment groups are the same, each participant is put into a study drug group by a computer. The study drug you will get will be chosen by chance, like flipping a coin, random. This is a double-blinded study, which means that neither of you, the study doctor, nor the study team will know what study drug, brensoactib 10 mg, brensoactib 25 mg, or placebo you have received until you complete the study. In an event of an emergency, the study doctor will be able to find out which treatment you have been given if he or she feels that knowing the information will affect your care during an emergency. All participants will complete the same study procedures. The study will last approximately 62 weeks from screening, visit 1 to visit 12. There will be 12 visits, including the screening, visit 1, treatment visits 10, 6 visits are in the clinic, visits 2, 3, 5, 7 and 9, 11, and 4 visits are by telephone from your home. Visits 4, 6, 8 and 10, and an end of study visit 1. The end of study visit 12 will occur in the clinic. You are encouraged to attend your clinic visits. However, if you are not able to come to the clinic due to health problems or concerns, please contact your study doctor. Screening and informed consent. During your first visit, the study will be explained to you. You will have the chance to read this form and take a copy with you home to discuss with your family and friends. The study staff will answer any questions you have about the study. If you choose to participate in the study, you will be asked to sign and date this form. You will get a copy of this form to keep. You must sign and date this consent form before the study procedures are performed. After signing and dating this form, you will be evaluated for eligibility based on certain criteria. You will be asked some general questions about your health for your safety. It is very important to give a complete, accurate information. You will be asked about your medical history and any medications you take. Screening tests will be performed. If you're eligible, participants will continue the treatment period by signing and dating the consent form and agreeing to the following instructions that are provided to you by the study doctor and the study staff. Study drug and what is expected of you. The study doctor will provide the study drug and instructions for taking it. The study drug can also be delivered directly to your home by a courier if you're unable to attend clinic visits due to public health concern. Brensoactib 10ml, 25ml, or matching placebo will be provided to you. The study drug is a tablet. You will be asked to take your study drug once daily before breakfast with a glass of water on an empty stomach. At approximately the same time every day, it is important you take the study drug around the same time every day. On the days of in-clinic visit, study drug will be administered at the clinic by the study personnel after specific study procedures are completed to record when you take the study drug. You will be given an electric dosing diary. Tablets should not be broken or chewed. If a dose is forgotten but remembered before midnight of that day, the missed dose should be taken immediately. Otherwise, the dose should be skipped for that day. You will be advised to bring all your untaken tablets in a bottle in which they provided along with the electronic diary to each visit during the treatment period. The study doctor may interrupt the study during drug dosing, i.e. may stop the dosing for a period of time and then restart dosing, if, according to investigators' opinion, it's in your best interest. A follow-up. After completing the study drug period, you will continue to be followed for 1 month while you're off study drug. You will be asked to stop all study drugs and return all unused study drug. A final visit will occur at week 56 and visit 12. This is to make sure you are in stable health before you are released from the study. Study exclusions. The study doctor will determine if you are eligible to participate in the study. Some reasons you may not be qualified include the following. You have a chronic obstructive pulmonary disease or asthma. You receive supplemental oxygen more than 12 hours a day. You have bronchiectasis due to cystic fibrosis. You are a current smoker as defined per Centers for Disease and Control. There is no evidence that you have bronchiectasis. You have a known or suspected immune deficiency disorder. You have human immune deficiency virus HIV. You have hepatitis B. You have hepatitis C. You are currently being treated for non-tuberculosis. You have an active and current symptomatic infection by coronavirus disease. You are not able to perform an acceptable spirometry examination. You are unable to follow the procedure of the study due to language or problems, psychological disorder. You are receiving medications or therapy that are not allowed during the study. You start oral antibiotics or a continuing inhaled antibiotic started and lasted 3 months before screening. You are taking oral steroids, except steroids with topical anti-inflammatories. I don't know what that means. 17. You had adjustments to your baseline medications within 1 month of screening. However, you can research a month after the new treatment has been initiated. 18. You have an abnormal renal function test kidney result. You have an active liver disease. You have a history of cancer in the past 5 years. You previously participated in this clinic before, in this trial before. You have an absolute neutrophil count of 1,000 millimeter. You have received any live attenuated vaccine within 4 weeks prior to the administration of brensoactib. You coughed blood 300 mils requiring blood transfusion with 6 weeks prior to screening. You are diagnosed with periodontal disease. You have pulmonary exacerbations 4 weeks before screening. You are unable or fail to fill in the electronic diary. You have participated in any other clinical studies within 3 months before screening visit. You have papillomavirus syndrome. You have other severe illnesses that would affect your participation in the study. You have abnormal laboratory values or disease or disorders that put you at risk by participating. You have a history of alcohol or drug abuse within 6 months of the screening visit. Any other medical or psychological condition that suggests a new or insufficiently understood disease that may interfere with the study assessment. You are a staff member directly involved in the conduct of the study. You have a hypersensitivity allergy to brensoactib or its ingredients. So they're the reasons why you won't be allowed to do the trial. What procedures are involved? You will participate in 12 visits with the study centre approximately 62 weeks. Study tests and procedures are described below. You will require to attend 8 visits in the clinic. Visits 1, 2, 3, 5, 7, 9, 11 and 12. You will have 4 telephone calls or other virtual methods with the study doctor or staff. Visits 4, 6, 8 and 10. You may be offered an opportunity to have some study visits performed at your home if needed. If you and your study doctor agree to utilise home care service, a licensed nurse will contact you to schedule the visit. The home care nurses supporting this study have received specific training on this study and will communicate frequently with your study doctor and the study staff. In order to conduct the home visits, the home care nurse, the home care agency and the home care services provider may have access to your individually identifiable protected health information, such as your name, address, phone number. This information will only be used as necessary to schedule and conduct home visits and will not be provided to the sponsor of the study. It is important that you participate in all of your visits during this study to evaluate your health and the effects of the study medicine. You cannot eat 4 hours before each clinic visit. If you have eaten within the last 4 hours, you will be asked to come back again. The amount of time you will spend in the clinic at each visit may vary. This is because the tests and checks will be different each visit. Talk to your study doctor if you want to know more about this. You may be asked to come for extra visits, for example, if you have a side effect that the study doctors need to look at. Physical health review. At each visit, a member of the study staff will ask you about your physical health, side effects, and any medication you have taken since your last visit. For your safety, it is important to give a complete and accurate information. Physical examination. At the screening, visit 1, at 52 weeks, visit 11, you will have a physical examination that will include the measurements of height, only at the screening visit, weight measured at the screening visit, and at week 52, visit 11. Additional physical examination may be performed at any time if the study doctor feels it's necessary. Measurements of vital signs. For your safety, your vital signs will be measured once at every in-clinic visit. These measurements include temperature, heart rate, respiratory rate, oxygen saturations, and blood pressure. Electrocardiogram. ECG will be administered at the screening visit 1 and at visit 2, 3, 7, 9 and 11. An ECG is painless test to check the activity of the heart. Chest computed tomographic scan. At the screening visit, you must provide a high-resolution CT scan of your chest for the study to evaluate for the presence of the NCFBE. If the CT scan is older than 5 years, or the quality is such that the diagnosis of the NCFBE cannot be determined from it, you will be asked to have a new CT scan during screening period. The screening period is up to 6 weeks. Therefore, there is the potential of having CT scan during the screening period. CT scans use ionizing radiation to form images of your body, provide your doctor with clinical information. Radiation can cause cell damage after many years, turns cancerous. We all are at risk of developing cancer during our lives. That's normal risk. That this will happen in 1 in 2 of us. The risk of taking part in this study is 1 in 2000, which is low compared to the natural risk. Pulmonary function test. A series of pulmonary function tests, PFTs, will be performed to see how well your lungs are working. The PFTs will be performed at the screening visit 1, visits 2, 5, 7, 9 and 11. Blood, urine and sputum samples. Blood samples about 8 mm per sample, or approximately 1.5 teaspoons. A urine sample about 5 ml or 1 teaspoon will be collected following time points during study at the screening visit 1 and at visits 2, 3, 5, 7, 9, 11 and 12. During the entire study, approximately 64 millilitres of blood, approximately 13 teaspoons will be collected from you. In addition, approximately 40 millilitres of urine will be collected, 1 teaspoons. Sputum samples, approximately 3 millilitres per sample will be collected at the screening visit 1 to see if there's any bacteria in your lungs. As a part of this study, samples that are not immediately used for testing can be frozen and stored. The purpose is to make these samples and information available for future research that is not yet planned. If you decide to allow storage, any part of your sample that is left over after testing will be stored up to 2 years from the completion of the study. If you do not wish to have your sputum sample stored for a period of up to 2 years beyond the duration of the study, you may request at any time that your samples be destroyed. The samples will be destroyed following the standard laboratory procedures. Your health history or screening test may show other reasons why you may not participate in the study. The staff will discuss this with you. Just making sure we're on the right track here, guys. I don't want to be jumping a gun like I've missed a page. Feel like, yeah, I went that we're back on track. You will be informed in the case of any plans for new analysis of the stored samples not mentioned above. In this case, you will be asked for a new consent and you have the right to refuse any further testing. Smoking status. At each visit, both in clinic and telephone visits, beginning with the screening visit 1, you will be asked about your smoking status, whether or not you smoke, how long you smoked, whether or not you have quit smoking, and how long since quitting. Questionnaires. During the study, you will be asked to fill out 3 electronic questionnaires. These questionnaires include quality of life questionnaire, validated translations available in local languages. You will be asked to download the app on your phone, or you will be provided with an electronic diary or other device for entering responses to the study questionnaire. The diary or device will come complete with a data plan for internet access. If you decide to use a study provided device, we ask you to look after them, and you will need to return it to study site after your participation ends. If the device has malfunctioned, breaks or is stolen, please contact study site. Where validated, translations are available in local languages. The bronchiectasis exacerbation symptom tool BEST is a daily diary for bronchiectasis symptoms that measure day-to-day changes in your symptoms. You will be asked to complete it daily and on an electronic diary from screening visits 1 up until week 56, visit 12 in the evening. Other assessments, days of work or school missed. The study site personnel will also check to see if you have missed any work or school days due to worsening of NCFBE. This assessment will occur at every study in clinic, telephone visits except screening visit 1. Assessment pulmonary exacerbation. The study doctor will also check to see if you've had any worsening of the NCFBE. That would count as a pulmonary exacerbation. This means that worsening NCFBE has caused at least three or more of the following symptoms for the least 48 hours and resulted in doctors' decision to prescribe antibiotics for you. Increased cough, increased sputum volume, change in sputum, increased sputum, for example, increased thickness and increased yellow colour, increased breathlessness or decreased exercise tolerance, fatigue, tiredness, hypothesis, blood in sputum. In addition, if your doctor admitted you to the hospital or ordered intravenous IV antibiotics for you, these events are considered severe pulmonary exacerbations and will be counted as such. Assessments of adverse event. At the study visits, beginning with visit 2, you will be asked if you think you have had any side effects while taking the study medication. Tell the study doctor about anything that happened that caused your discomfort or concerns, even if you aren't sure it was caused by the study medication. Dental hygiene education. You will receive instruction on daily teeth brushing and flossing at the screening visit 1 and at each visit 2 up to 11. There is a small chance that the study drug affects the health of your teeth and gums. However, the chance of this happening is about the same chance whether you receive brensoactib or the placebo. The placebo pill contains no active drug substances. If necessary, you may be referred to a dentist for further evaluation. You will undergo an examination of your teeth and gums by the study doctor each time you come to the clinic, visits 2, 3, 5, 7, 9, 11 and 12. For each of these telephone visits, you'll be asked if there's any problems with your teeth or gums. Assessment of skin conditions. You will also undergo examination of skin, especially of the palms, hands and the soles of your feet, the skin, the knees, the elbows. Visits 2, 3, 5 and 7 and 12. Brensoactib can have an effect on your skin. However, in previous study, brensoactib, the most commonly reported skin-related side effect was dry skin, which is reported in 3.5% of participants who received brensoactib and 4.7% of the participants who received the placebo. What's the potential risks or discomforts? Because brensoactib is an experimental drug, it is not possible to know all of the possible side effects taking it. Some of the side effects may not be unexpected. As with all drugs, side effects may happen. Your study doctor will watch you closely for possible health problems that may happen in a result of taking part in this study. If side effects happen, they will need to be treated. You may be asked to take a clinical test if you have any side effects in the study. The study doctor may remove you from the study. You must tell the study doctor or staff about any side effects that you may have throughout the study. If you do not tell the study doctor and the study staff about the side effects, you may harm yourself. To help the study doctor manage your care and should report any side effects, illnesses or changes in your health that you notice. This is important even if you do not think it relates to the study drug. In previous study of brensoactib, in which 170 participants received brensoactib and 85 participants received placebo, the most commonly reported side effects occurred in 5% or more of participants in any treatment group were cough, headache, increased sputum, shortness of breath, fatigue, upper respiratory tract infection, infective exacerbation, worsening of bronchiectasis, sinusitis, diarrhea, pains in the joints, periodontal disease, and pneumonia. Tell the study doctor and study staff if you have any of the above symptoms or have any side effects during the study. The study doctor or study staff will explain to you what to do if you have any of the symptoms above: allergic reaction, rash, wheezing, difficult breathing, dizziness, fainting, swelling around the mouth, throat and eyes, a fast pulse and sweating. Are there any reproductive risks? The effects of the study drug on babies, embryos, and fetus are unknown. It is very important that women do not become pregnant while participating in this study. All women of childbearing potential must have a negative pregnancy test before they can enter the study. A blood pregnancy test will be done at the screening visit. A urine pregnancy test will be performed at baseline day 1 and all other visits. For telephone visits, women childbearing potential will be provided with urine pregnancy kits. The test should be performed at home on day of the telephone visits and results reported in the telephone visits. The study doctor may request pregnancy tests to be performed at any time during the study if the doctor decides the test is necessary. Women in childbearing potential must agree not to become pregnant while participating in the study. Men entering the study must agree not to take their partners pregnant, to make their pregnant part pregnant. So, as reading that, it could have an effect even if it's the male taking it. All study participants and their partners must agree to use highly effective method of contraceptive from day 1 to at least day 90 after the last dose of the study. I've lost where I am. Last day of the study drug unless they are postmenopausal. No period for the last 1 year without an alternative medical cause or surgically sterile. Women 45 years of age and younger childbearing potential will have an additional blood test confirm fertility status at screening. The investigator or study centre staff member will explain the acceptable methods of birth control to you. You will be asked to follow their direction. Acceptable methods of highly effective contraception include true abstinence, refraining from heterosexual intercourse during the study, combined estrogen and pro-estrogen containing or pro-estrogen only hormone, contraceptive associated with inhibition of ovulation and supplemented with double barrier method. I'm not reading all that. Please note, male participants with pregnant or non-pregnant partners, women of childbearing, must use condoms to avoid any chance that the study drug brensoactib will be passed to the developing child in the womb. If you become pregnant, suspect you are pregnant, or your partner becomes pregnant, if you're a male participant during the study, you should notify the study doctor immediately if you are pregnant. I'm a bit lost there. You will need to stop taking brensoactib immediately and will be discontinued from the study. Safety follow-up visits will then be scheduled. The outcome of the pregnancy must be reported to the sponsor by your doctor. Additional follow-ups may be required, including monitoring the health of the child for the first year after birth, if applicable. If this is the case, you will be provided with an additional pregnancy-related ICFs to review and sign. If your partner becomes pregnant, she will be asked to sign and date a separate consent form to allow the study staff to collect information about the pregnancy, its outcomes, and if the health of the child after the birth. Also, breastfeeding women cannot participate in this study because the study drug could be passed on to the body of the child with breast milk and possibly have harmful effects on the child. Right, down here it's just talking about your CT scan. We all know that after you have your procedure, your CT scan. A CT scan takes 30 to 60 minutes. It's a contrast dye is to be used for the scan. You must not drink or eat anything for 4 hours before the test. You must remove all jewellery. A tourniquet will be applied to your arm. A dye will be injected. You may have pain when the needle is inserted in your arm. When the contrast medicine is injected during a CT scan, you may experience nausea, flushing, warmth, or a salty taste. You might have an allergic reaction to the contrast medium. If this is the case, please inform the study doctor. During the test, you will lie on your back on an X-ray table. A strap will be placed across the body part to be scanned, which will prevent movement, so the X-ray picture will be clear. The table will then slide into a large tunnel-shaped machine. You might feel uncomfortable. While you are in the tunnel-shaped machine, some patients have felt claustrophobic during this test. Please speak to your doctor if you have any concerns about this. When CT scan is finished, you may immediately resume your usual activities and diet. CT scans use ionizing radiation to form images of your body, provide treatment, and provide your doctor with other clinical information. Ionizing radiation can cause cell damage that may, after many years or decades, turn into cancer. We are all at risk of developing cancer during our lifetime. The normal risk is that this will happen to about 50% of the people at some point in their life. Taking part in this study will add only a very small chance of this happening to you. Discomforts caused by the study. There is no pain or discomfort during an ECG. However, removing the adhesive sticky pads may cause some discomfort or irritation to your skin. You may experience bruising from blood pressure cuff. Blood samples will be taken from a vein in your arm by a needle. Risks that can occur with blood samples are taken include pain, bruising at the blood sample collection site. You may experience lightheadedness or fainting at the time of blood collection. Some bleeding, infection, or clotting at the site of needle stick also could happen. During the pulmonary function test, you may become dizzy or lightheaded, have chest pain, shortness of breath, feel nervous, or feel that your heart is racing. This may be because during the PFT test, you normally have periods where you must blow out all of your air and hold your breath for a few seconds. You may feel tired when the PFT is completed. Rest until you feel comfortable before leaving the study. If you hold private medical or travel insurance, you may wish to check with the insurance company before agreeing to take part in this study, as your taking part may affect the insurance. Possible benefits of being on the study. You may or may not benefit directly from taking part in the study. Your condition might stay the same, get better, or might even get worse while you are on the study. Your participation in this study might help doctors learn more about brensoactib as a treatment for the NCFBE and help future patients. Are there any alternative methods or treatment? You do not need to participate in this study to be treated for NCFBE. If you decide not to do this study, your current treatment plan will not be affected. You can receive treatment outside of this study if prescribed by your regular doctor. The study doctor or your regular doctor can discuss other treatment options that are available for the NCFB, any known risk relating to these treatments before you decide whether or not to participate in this study. By participating in the study, you are not allowed to receive treatment with the following medications, which are sometimes recommended for patients in your situation. Use of any inflammatory immune allergy, I can't say that. Immune, I'll leave that one, agent within 4 weeks before screening, including but not limited to brensoactib, iazotamide, and phyloidamide. Cannot even write these or even begin to try and spell them out. We'll leave them because these are doctors' terms medication that the brain can't function, let alone the mouth. Continued use of high-dose steroids is prohibited during the study. Chronic use of systemic steroids for any chronic condition except steroids with topical anti-inflammatory activities. Live antenatal vaccines prohibited during the study. In addition, major elective surgical procedures may elective This is a periodontal procedure cannot be scheduled for you while you're participating in the study. If your regular doctor feels it's necessary for you to receive any of the treatments, you will have to stop your participation in this study. Will you be informed if new information about the study drug becomes available? While you're on the study, you will be told of any new information, good or bad, about the study drug. The new information may change your mind about being in the study. You are free to stop your participation, withdraw at any time. If you wish to stay in the study, you may be asked to sign a new informed consent form to continue. What happens if I change my mind? Participation in any experimental clinical research study is voluntary. If you decide to take part in the study, later change your mind, you are free to leave the study at any time. There is no penalty if you choose not to participate or to stop participation in the study. Whether or not you choose to participate in the study will not affect where or how you receive medical care. Even if you qualify to participate in the study at first, you may be removed from the study at any time if you or the study doctor sponsors decide it's not at your best interest to continue your participation in the study. Reasons for removal include, but are not limited to, the following. You no longer wish to be in the study. You become pregnant. You do not follow instructions the study staff give you. You use medication that is not allowed during the study. You no longer meet the study requirements. Your study doctor decides that it is best for your safety. Sponsors or regulated agencies decide to stop the study. Sponsors may stop the study for any reason. If you are removed from the study before you complete all study visits, you will be asked to return for a safety follow-up visit, and the study doctor will discuss the reasons for stopping your study. If you decide to permanently discontinue the study treatment drug, you will be asked whether you wish to continue with the remaining scheduled visits and follow-ups. Expense and payments. You will not receive financial compensation or payment for taking part in the study. That's not good, is it? You may be reimbursed for any reasonable expense incurred as a result of taking part in the study. I'm not going to read all that. Don't think that's beneficial for reading to you, to be honest. I think it's just wasting time. This is just going on about complaints and harm. If you are injured, we'll just talk about the harm. If you are injured because of your participation in the study, you'll be entitled to receive compensation according to UK legislation. Please contact your study team if you feel this is the case. That's not anything worth reading about. Study monitors and auditors who may ask for MSED Incorporated or its authorised agents who check the study is being performed correctly, that the information collected about you is accurate. It just goes on that they'll be checking your ethnicity, nationality, to ensure that your privacy, your name is kept safe. You can stay with him for 15 years. I'm just breaking this down now because it is going on, so they can store your information for 15 years. You also have the right to complain about your information handled to the supervisor or authorities. So that's basically just about data protection, page 16. What will happen to the samples I give? The blood and urine samples collected during the study will be used for routine tests analysed at Central Laboratory PPD in Belgium. Additionally, blood and urine samples will be stored for a period of up to 2 weeks and sputum samples up to 2 years before discarding after test date, unless otherwise required by institution participating in the study. The samples will be stored at central laboratories and only accessible to authorised laboratory personnel. The sputum samples collected during the study will be used to test for bacteria causing urine infections and will be sent to the International Health Medical Association, which is in Switzerland. If you do not wish to have your sputum samples stored for a period of up to 2 years, we know that we can tell them not to, so we won't read that. We read that earlier. As the study received medical or ethical approval, all research in the NHS is looked at by independent people of so-called research ethics community to protect your interests. The study has been reviewed and given favourable opinion by London, Surrey borders and research ethnic communities. We're getting near the end, guys. If you stay with us, you've done better than I have. Involvement of the general practitioner family doctor. Your general GP or family doctor will be notified of your involvement in this study. They will be asked to pass relevant information about your health status and medication to the study doctor, who can contact you with further questions. You may ask questions about the information sheet and consent form at any time. For study-related questions, contact study sponsor. For study-related injuries or emergency, contact study sponsor or study staff. For more information about your rights as a research participant or complaints about the study, please direct inquiries to Salford Royal, in my case. So we're getting near the end, guys. We are getting near the end, don't you worry. This is just getting to the consent form that we don't really need to talk. Page 19 of 21. And page 20 is the last little bit, that what will happen to your data. I think it's quite important you speak about this. The authorised representative of IMSMID Incorporated, the Ethics Committee and regulator authorities, inspectors may have direct access to your medical records. Study data, included your coded medical information, may be retained and later used for further research in your medical indication unless you object. Study may be transferred to other countries for study purposes, including countries not providing the same standard of legal protection for your personal information. Ooh, as in Europe, that is a big no-no. If your information get leaked like that, that's a big no-no. Yeah. I give permission for personal information to be shared with Scout Clinical Third Party as outlined in the expenses payment section. I agree to my GP being informed of my participation in the study. I specifically agree to my personal information and blood samples collected during study being sent outside the Europe Union as described in this information sheet. I understand I will receive a copy of this signed and dated information sheet and consent form. By signing this form, I have not given up any legal rights that I would otherwise have as a participant in an experimental clinical research study. So I've just broke it down for you there, guys. It took longer than I thought. We're still on the statement of consent here. I have read, or someone has read to me, the information provided. I confirm I have had an ample time to read and understand the information for this experimental research. I have given a chance to ask questions to help me understand what I'm participating in. The study staff will give me information about what will happen during the study. I was told how long the study will take. I was told how this research may affect me or my health. This information included possible inconvenience, discomforts, or risks. I understand my participation is voluntary and I am free to withdraw at any time without giving any reason, without my medical care or legal rights being affected. I confirm that I have told study staff about clinical research study that I am participating in or I've participated in within the last 3 months. I understand the study or doctor sponsor may end the participation in the study at any time for any reason without my agreement. The reason for doing this will be explained unless the reason becomes known after the study visit has ended. So that's it. Sorry for the waffle. I did think in this piece of paper I've just read that's took my breath away and my voice. As you can see, when we got bronchitis and we talk too long, we get a bit of a hoarse voice, so we lose the voice. Same way we do when we have the inhaler. When we have the inhaler, the steroid one, it does the same thing. But nice one for wishing me well. So basically, that's all it is really. There's nothing compelling in this piece of paper here that says this is going to work. It still shows me that the Rundor trial, they're still researching it. They haven't given me any numbers from the American research. They're just basically telling me that it can have a good effect, a bad effect, and even worse than an effect. So I am going to think about it. I was quick to say, I'm going to take this as a part of the research. I'm going to feel better. It's a super drug. But I think what I'm going to do in the up and coming weeks before starting it, I'm going to research it a little bit more. I'm going to see what people who have took the drug stateside have had to say about it as it's changed their life for the better. And that's it. And the only bummer about it, you don't get paid. You normally get paid for clinical trials, but not in this case. But it's not all about the money. It's what it does to the body. Because remember, health is better than wealth. On that note, stay sexy. And if you've got little shits like this that are nearly teenagers, give them a quick rub on the head. Bye.